for everybody around you. Continue wearing your mask, continue social distancing, even if you've been vaccinated, because we don't know if you can still spread it, just that you shouldn't get sick. Let's make sure that we protect one another until we ultimately reach the level of immunity that we need to here in the Commonwealth and across the country and the world. One other piece of really good news is today, the Kentucky Transportation Cabinet, Secretary Jim Gray and I announced the end of a 6-week emergency repair to restore and reopen the Brent Spence Bridge one day ahead of the scheduled completion date. Travel lanes and various access ramps leading to the bridge will gradually reopen to full capacity throughout the afternoon and evening once lane striping on the upper and lower decks is complete. Thank you to everybody involved. We're thankful for your quick work. This is ahead of schedule and under budget, and that's what we like to hear. And this is an incredibly important bridge on a main artery for commerce throughout the United States, and a heavily trafficked bridge for our citizens in Kentucky as well as Ohio residents. So we're very excited about this. And when you first saw that crash and the intense fire that came from it, this is really good news. All right, moving into our COVID report for the day. Again, this is one of those days where our numbers are high, but pretty close to what we saw last week, which overall is good news in that we have certainly stopped the exponential growth that we are seeing. But our cases are still too high, and we need to continue to work to make sure we can lessen them. So today we're reporting 3,057 new cases of COVID-19. I want to tell you that compares last week at this time to 2,898. So pretty close. And when you look at yesterday and the day before, right now we are tracking slightly under what we saw last week. Our positivity rate also down a little bit today at 8.48%. Unfortunately, we are reporting 28 new deaths today. That brings our total cases to 247,344 and our total deaths to 2,440, far more than any of us ever wanted to lose. New cases by county: Jefferson 468, Warren County 136, Madison 127, Fayette 125, Kenton 113, Christian 105, Davis 89, Boone 88, Laurel 81, again another incredibly high day for Laurel County, Pike 61, Clay 53, Campbell 47, Henderson 44, Knox 43, Hardin 42, Pulaski 40. You can see the other ones on kycovid19.ky.gov. And there are these 28 new deaths, which again are 28 families that are going to need our prayers and our help. Continue, lighten your homes and your facilities up green. It's the color of compassion and renewal. Compassion for the families and their mourning. Renewal because that person's body is just a vessel and their soul is moving on to a better place. Also, let's ring those bells at 10 a.m. every morning. You never know who's listening. You never know who may find a moment of help in them, who may find caring, who may believe that they are alone in this world and in this Commonwealth right now, that just sees that effort, sees those lights, or hears that bell and realize that even though they don't see and get close to people, that we are in this together and we'll get through it together. So the new deaths today include a 91-year-old woman from Boyd County, a 91-year-old woman from Callaway County, a 94-year-old woman from Callaway County, a 66-year-old man from Casey County, a 64 and an 87-year-old women from Davis County, a 71-year-old man from Davis County, a 67-year-old man from Fleming County, a 67-year-old woman from Graves County, a 57-year-old woman from Henderson, a 63-year-old woman from Henderson, a 58-year-old man from Henderson, and an 83-year-old man from Henderson, a 67-year-old man from Henry, a 67-year-old man from Hopkins, a 74-year-old woman from Jackson, a 53-year-old woman from Jefferson, a 62-year-old man from Jefferson, an 81-year-old man from Knott, a 79-year-old man, and an 85-year-old man, both from McCracken. We lost 3 individuals from Marion County, all women, ages 86, 94, and 96. 2 more losses in Monroe County, an 87-year-old woman and a 59-year-old man, a 60-year-old woman in Perry County, and a 54-year-old woman in Todd County. This certainly feels and looks like some of the youngest average age that we have seen in our reports, and certainly 28 people is far more than we want to see. That's why stopping that surge was so important. But remember, deaths follow cases by several weeks, and so we'll continue to see some high numbers because of how significant that growth was. We'll also continue to see high numbers if we keep having 3,000 cases in a day. Again, it's good that it's not growing anymore. It's good that it's even come down a little bit, but we need to push it down even further. Long-term care facilities, 115 new residents, 72 new staff testing positive, 18 additional deaths attributable to long-term care. Finally, this morning, I, along with the head of each of the 3 branches of government here in Kentucky, were vaccinated, and included myself and my wife, Brittany, in the executive branch, along with J. Michael Brown, the top appointed official. We had Speaker Osborne and Senate President Stivers. We had Chief Justice John Minton as well. I want to thank all these individuals. This is putting any and all politics aside and setting the right example for the people of Kentucky that these are safe. There is no divide between any of us. The science is there. This is a miracle. And this is Michelle, who is a nurse at the Frankfurt Health Department. She's been incredible throughout this pandemic. It's been a friendship that I've formed. She gave everybody else the vaccine and then was vaccinated herself. It had been about 7,000 people in the Commonwealth vaccinated before we were, and it was pursuant to the direct request made over the phone to me and to other governors by the head of the CDC, Dr. Redfield. We've done our best to follow CDC guidance the entire time. He told us that it would help build confidence, and he wanted it done as early as possible. I feel absolutely fine. There is just a little bit of soreness in my arm. It is less than the flu shot, so I can report, about 6-7 hours after it that all is well. With that, we'll turn to questions. Again, this will be our last live update until Monday, and then we'll at least do Monday and Tuesday of next week, where we hope to have an update on our evaluation of the CDC next set of priority for vaccination, along with some other news. So we have a number of journalists on the line. We'll start with Stu Johnson from WEKU.
Good afternoon, Governor, and thank you. A friend of mine who has worked for years in a nursing home in Kentucky mentioned to me that estimated that 50% probably or more of the residents there either smoked or had smoked in their lives at some point. So at this point in the pandemic, we're finding there's a disproportionate number of people who smoke that are having difficulties with COVID.
I'm not sure that we have the data in Kentucky to make a direct correlation with that. We will get some information directly from Dr. Stack to you, but certainly this is a virus that attacks the lungs. Heart, lung, and kidney disease are what it preys on. And the more you smoke, the more you damage your lungs and the less resilient that they are going to be. It is also noted when we do have a death, whether that person has been a smoker. So I don't think that there's any question that your body is in better shape to fight off COVID if you are a non-smoker. And listen, smoking can kill you in a number of different ways. We as a state, whether it's to fight off a pandemic, whether it's just to improve our own health, or whether it's to lessen the significant costs to the state and private sector of treating those that develop lung cancer, we have to have fewer people smoking. And if a pandemic is not the time to give it up, given what it does to your lungs, then I don't know when is. So my hope is that that facility, along with others, will really work on a smoking cessation program, and maybe we here in state government can help. Karen Czar from WKY.
Good afternoon, Governor, and Merry Christmas. How
Merry
is
Christmas.
our PPE supply? And since, can you hear me?
Yes.
How is our PPE supply? And since it appears that we are in a plateau, those states who are now having difficulty, would we be able to assist them if they need it?
So first, our PPE supply is strong. The supply chains, with the exception of the N95 mask, are working pretty well. We still have our 120-day supply, and in fact, I believe we're about to have a very large donation of masks, which we're going to be able to push out. So right now, aside from the scarcity of N95 masks, we are in good shape on the PPE side. And we get reports from time to time of a person from this facility or that saying that there's not enough PPE. We contact each and every one of those facilities where we get the report. We talk it through. If they need help, we help them. Sometimes it's allocation within a facility or a misunderstanding. And then the second part of the question, Karen, can you remind me of that piece?
Sure. If there are states right now that are seeing a huge influx of patients at their hospitals, if they were to need help with PPE, is it something we would be able to help out with?
We'd certainly look at that. We haven't received any of those requests right now because that's not what we're seeing in other states right now. What we're seeing are their hospitals overrun. So it's truly a healthcare capacity issue in terms of staff or beds. And like we said before, especially if you're in the Louisville area where we would get Southern Indiana patients, we're not going to turn people away, even if COVID-19 is accelerating in their state, and while it's not in ours. I think it was mentioned by, maybe it was Al yesterday, Tennessee, and where they are with COVID is not a good place, and we will likely see an overflow from some of their patients. Tom Latek from Kentucky Today.
Thank you, Governor. Merry Christmas to you also. The latest round of help from Washington doesn't look like it's going to be any help for state and local governments. So what do you plan to do at this point without that help?
So there is the main help that we needed in it. There is over $200 million for testing and contact tracing. I think that's close to $300 million, but we've only seen an estimate. There is at least $59 million for vaccines and distribution. There are significant funds that'll go through, over $400 million will go through our economy from the additional $300 on unemployment. I think it's over $2 billion will be received by Kentucky residents for the direct checks. Over $100 million, and I think it gets north to $200 million in transportation aid, and we've got to see how that works. It looks like there is a fund to help burials, which is, that's something that's going to help people out when it's been a very difficult time. Something I'm really excited about is we believe that there's going to be between $250 and $300 million in an eviction relief fund that can also be used for utilities. So there's not direct budgetary relief, but from everything I've seen, this is a package that's going to help us and help us significantly. And for it, I'm grateful. With the fiscal management that we've engaged in here in Kentucky, I believe our budget is going to be in good shape and actually let us provide additional relief on top of this, as well as true investment, because now's the time. right, we're going to determine where we fall in the post-COVID world based on being bold in this next budget, making sure that we are investing in infrastructure in ways that create jobs and positioning ourselves for the future. This is truly a time where we'll decide whether this state is going to be FDR or Herbert Hoover, to move to the front and to lead, or to simply sit back and wait and watch while other people sprint forward. Al Cross from Kentucky Health News.
Governor, I'll just follow up with that. At the end of the year, December 31st, how much CARES Act money do you expect to have left over that you will still be able to spend in 2021? And what do you want to spend it on?
Right, and we'll get you an exact breakdown of that. I believe it's going to be in the neighborhood of $200 to $250 million. The majority of that will go to the loan we took for unemployment. And then we're going to be talking here in the very near future about ways that we can help out those that have been waiting for unemployment benefits for far too long, that don't have any fraud issues, that don't have any identity issues, ways that we can help those that are, again, have waited far too long through no fault of their own. So we've used this funding, I think, wisely. We can get you a direct breakdown of how it's being used, minus those very last decisions, directly to you as well. Shelby Smithson from WKYT.
Good afternoon. I have two questions, if you don't mind. The first, the only governor younger is Florida's, who said yesterday he wouldn't step in line to get the vaccine because he too is under 45. Can you talk about why you feel it was important for you to go ahead and get the vaccine today? And then also an update on unemployment, because we are still getting multiple calls a day from people having trouble getting their checks.
So I'll start with unemployment. We continue to work day in and day out, and will not be satisfied until everybody gets their benefits. We have a challenge here in that we've received such differing guidance from the Department of Labor over time that I believe their OIG has launched an investigation into that guidance and how it's been given. Certainly at the start it was get it out really fast, and then in the middle it was like, oh wait, you should be spending more time ensuring that there's zero fraud in the unprecedented amount of benefits that you're providing. And so we've had this push and pull that's made it really difficult. That's compounded by an IT system created in 2000 that we got a code just to get basic information out of, and that we are going to have to, with the new CARES Act, go in and reprogram, because they've changed once again who qualifies for this extra $300. We had, at the beginning of this crisis, 90 less people in unemployment in the office because of cuts made in a previous budget, and very few regional offices open. The other challenge is the whole system set up, federal and state law, is to create problems. So we don't just spend every day on new claims that have been filed or claims that we haven't gotten to. We've got people who've been on it for 2 months and then may answer a question wrong in the system. And you got to spend that 10 or 15 minutes to walk them through it, to get it right for them to continue their benefits. So it's hugely burdensome, hugely time intensive. I was vaccinated today for 2 reasons. Number one, the director of the CDC personally asked myself and every other governor to get vaccinated publicly as soon as possible to build confidence in this vaccine. We have followed the directions of the CDC. The governor of Florida hasn't, whether it's his refusal to put in a mask mandate or do what's necessary to stop this current surge. You look at the significant death that that state has experienced, and maybe you ought to listen to the CDC director a little bit more. Now, the second reason was Dr. Stack recommended it at the top of every level of government. So today, you have the top of the judiciary, the top of the 2 legislative branches, and I'm the top of the executive branch. We were certainly not the first, about 7,000 before, but listen, there is real hesitancy out there. And today, live for anybody to broadcast, I didn't just take it. You know, the First Lady took it. And I would never suggest that to her. It'd ultimately be her decision if I didn't believe it was fully and entirely safe. And that's what I want the people of the Commonwealth to know. I believe that in my heart. I believe it enough to watch Brittany take that vaccine. This is safe. It is a Christmas miracle for us. And we got to make sure that, especially with this new strand they see in the United Kingdom, that we get 70, maybe even 80% of Kentuckians and Americans vaccinated. Mike Valenti from WLEX.
Yeah, thank you, Governor. I want to stay with questions about what's not in the stimulus bill, and not to belabor the point, but you've been beating the drum for months talking about how imperative it was that state and local aid be included in the next round of CARES Act funding, and pushing back on that blue state bailout narrative. Now that there's not budget relief in this bill, and if there's not a third package that comes that includes it, what are some of the repercussions that the state government could face and local governments could face, specifically in terms of hiring and government spending?
So certainly, originally, all the testing and tracing where we've got, you know, $300+ million between that and vaccines, that was originally all included and discussed in state and local aid. So what I'm saying is we do have some state and local aid here, but budgetary relief and a lack of it is going to hit localities, cities, and counties, I believe pretty hard. Just because the state budget might be in one place doesn't mean that their budgets aren't going to be impacted. Now, we were able to open up more CARES Act money. We added, I think, $26 million more on top of the $300 million we'd originally provided, so that we could have a second round of cities and counties that got dollars. I believe that we've seen some really good funding there. Other areas that will be hit, corrections, especially jails, and all the extra expenses that they've incurred. Another round of CARES Act funding could be very helpful there. And certainly it could allow us to do more to stimulate our economies on a local basis, whether that is through cities and counties or through the state. But this new CARES Act, I know that they got caught up on terms here and there, but it includes a lot of things that help us out and help areas that we had budgeted for. We were budgeting previously for about $300 million in testing and vaccine distribution expenses through the first half of the year. So that's a $300+ million positive that we got through this. And again, I think it does have state and local aid in it. It's just directly on the testing, contact tracing, and vaccine side, and that's what we needed the very most. Morgan Watkins from the Courier-Journal.
Hi, Governor. I was wondering if you have any kind of different plans in terms of the vaccine plan for next week, if it's going to be the same as what we've seen these last couple weeks with long-term care and healthcare workers getting it, or if there are any differences for the final week of the year.
So throughout December and at least through the first half of January, it's just going to be those two groups. It's the frontline healthcare workers, and that includes EMS and EMTs, and long-term care. Just with the allocations that we believe we're going to receive, all of that is going to go to those two areas. Next week, we're going to have finished our analysis of ACIP. That's a part of that's a group that recommends to the CDC who comes next in priority. And that'd be optimistically the second half of January, probably the beginning of February. And right now what they've said is individuals over 75, which is an ascertainable group. And once we have already done long-term care, that's a group that we could really create a program on and have enough vaccines to be moving through. And then a huge pot of essential workers. And first of all, I want to say every life is essential. This is what the CDC has labeled as essential workers. And it is too big, even the group that they did, to be able to handle all at once. And so we'll be looking certainly at priority there. And we'll have more information on that next week. But everything that we'll receive probably through the second week of January. At the most optimistic, we'll be going to those groups. So everybody know that we're dealing a massive blow to this pandemic by prioritizing long-term care. We are giving a second win to our frontline healthcare workers. I think you saw that from our good doctor yesterday that runs the COVID unit at UK. I know this first part are the right priorities, and our goal is to make sure that next part is one that people can understand and accept as well, because the patient's piece is going to be really hard. And we've run long a lot this week, so we're gonna close out early today. I want to say to everybody, Merry Christmas and Happy Holidays. Make sure you do this right. Make sure you keep it small. How you handle Christmas and New Year's may determine who's around next Christmas and New Year's. We just got recognized by the Washington Post as doing things right. Let's keep doing things right. I hope you're proud of that. And to continue to get results that we can be proud of and protect one another, we need to make sure, again, that we keep our celebrations through these holidays very small. Merry Christmas, everybody. See you Monday.